morning, everyone. I am Lorraine. I am from Hayat Institute. I'm a nurse by profession. I'm an EMT by practice, and Hayat Institute is a private business on the side. So thank you so much to Ms. Rachel and the organizing team for inviting us to give you some insights on infection prevention and control. Let's talk about different infection prevention precautions. We talked a lot about the infection cycle in itself. From the cycle, how do we break it? Now, how do we prevent? What are the precautions that we need to take? Why the use of the mask? Why the use of the gloves? Why all this hand hygiene, hand washing, alcohol rub, or the use of our sanitizers? Let's understand that further. After this session, we will be able to list infection prevention precautions, describe why standard infection prevention are used, list the reasons for keeping our hands clean, describe how to wash your hands correctly, describe the areas of the hands most often missed during hand washing. So now we have again the same diagram we had earlier. Okay? This is just emphasizing to you how to control them. We mentioned it earlier. Immunization, good hand hygiene, cleaning, use of face masks, correct dressings, again, hand hygiene, cleaning, good hygiene practices. If you will notice, hygiene is being mentioned all over because it is a way for us to control the spread of infection. Now, standard precautions is for everybody. We will be watching a video later on when we talk about the 5 moments of hand hygiene, how to wear personal protective equipment such as your mask, use of your gloves correctly, dispose and waste safely correctly, how to remove the gloves correctly, and how to dispose if you have any sharp objects correctly as well. Now, why is standard infection very vital to all of us? Infectious agents are potentially present in all our body surfaces. We don't see them. This is the hardest part. We don't know where they are. If it's something that we can see that we can just take away from us, it's very easy to combat it. But the problem is infectious agents are potentially present in our body and we just don't see it just like that. It's invisible to our naked eye. Precautions puts a barrier between the service provider and the individual, such as wearing the mask allows us to have a barrier between people who are infected for that infection to get out of their body, to be transmitted, and to enter our body. That's why precautions, using a barrier, is very important as well. Now, here's the thing. When and how to wear a medical mask.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough. Why? Because healthcare workers and caretakers are in close contact with ill individuals, so they're at higher risk of catching COVID-19. And sick people should wear masks to protect others from small droplets that can come out when they cough or sneeze. So, for healthcare workers, caretakers, or individuals who have fever and cough, this is how you should wear a mask. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Verify which side is the top. This is where the metal piece is. Then identify the inside of the mask, which is usually the white side. Then fit the mask on your face. Pinch the metal strip or stiff edge so it holds to the shape of your nose. Adjust the mask over your face, covering your mouth and chin, making sure there are no gaps between your face and the mask. Do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. To take off the mask, remove the elastics from behind without touching the front and keep it away from your face. Discard the mask immediately in a closed bin and clean your hands. It is important not to reuse the mask. Replace it with a new one as soon as it gets damp. And remember, the best way to protect yourself from the new coronavirus is frequently cleaning your hands with alcohol-based hand rub or soap and water. Stay safe and see you next time.
How to properly wear a mask? Make sure that the white portion of the mask will be inside and the portion that is hardened and bending should be on our nose bridge with the blue color of the mask outside. So we're going to fit that bending side of the mask towards our nose bridge and we are going to put the ear loops around our ears and we're going to pull the lower part of the mask to cover all our chin bone. Make sure the entire time that you're wearing the mask that you do not touch the outside of the mask because remember, people talk to you, people might be sneezing, there might be infection already on the surface of your mask, on the blue side. So when you touch the outside of the mask, make sure you wash your hands or make sure that you are going to have an alcohol rub. In addition, every time your mask gets damp or wet, meaning to say it's time for you to change the mask. Mask should not be reused at all. And mask, once it is wet and once it is damp, sweaty, already has to be changed. But how do you properly remove a medical mask? Some of us touches the mask from outside on the blue part and then remove it. No. Make sure you do not touch the blue side of the mask. You just remove the loops around your ear and discard the mask blue face downwards. Why blue face downwards? To make sure that we do not touch the blue side of the mask.